Hello, I'm Dr. Vikas Sharma, and today I'm going to explain everything about eyebrow transplants. Eyebrows, basically they are divided into three parts. First is the head, the body and the tail. So head is the most part closest to the nose, body is the middle part and tail is this part. Eyebrows are differently placed in men and women. In men, the eyebrows are primarily placed over the edge of the spoon, which is the orbital rim. It is more flat and the thickness of the eyebrow is similar throughout. In women, the eyebrows are a little bit higher than the edge of the spoon and they are more arched and rounded. In women, the density is more towards the nose and decreases as we go towards the ears. An eyebrow transplant may be required for multiple reasons. If somebody has lost his or her eyebrows because of burns, trauma, or any scarring alopecias, in that situation, a hair transplant is required in the area of eyebrows. The procedure of eyebrow transplant, first thing to do is to design the hairline. Now, a hairline is drawn according to the patient's preferences and according to the anatomical landmarks, as I have already explained. Once the hairline has been drawn, the local anesthetic injection is given into the area to make that area numb. After that, the area is remeshed with some solution so as to make it a bit swollen up, and then a few slits are made into that area. Now, the direction of the slits is very important. If you observe closely, the eyebrows towards the nose, they grow upwards, and in the body area they grow towards in a downward direction from the top and in a upward direction from the bottom, and on the sides they grow towards your ears. So this is what is to be followed while reconstructing an eyebrow. The second thing to be considered while making the slits is the angle of the slits. Now the hair in the eyebrows, they grow very flat, so the slits should be made in a very flat direction so that it grows almost on the skin. Once the slits have been prepared, the hair are taken out from the back side of the head or any other donor area which is giving us very thin fine hair. So it is important to give very thin hair in the eyebrows because very thick hair can look bushy. So we prefer an area something like the nape of the neck which has very thin fine hair which grows slowly and match the growth rate of eyebrows also. Once these hair have been extracted, they are implanted into the slits. Now this is how the procedure is done. There are minimal to no complications of eyebrow transplants usually. Usually the complications that are seen most commonly are slight bruising and swelling of that area, which lasts for a few days and then it disappears. Other than that, rest of the complications are pretty uncommon. Then there are some other side effects which can happen if you get it done from an unqualified professional. In that situation, the hair may grow in a wrong direction. If done properly, it can restore the facial appearance of the patient. If you like this video and want to know anything else about eyebrow transplants, please leave a comment in the comment section below. Also, if you want to know more about hair transplants and related topics, please subscribe to our channel.